Hey guys, Don here. Welcome to Podiatry Practice Mastery, where we're trying to help you get your practice to the $1 million mark and beyond. And I'm just going to share the things that we were working on in the office today. 23 patients here on this day that I'm recording. First patient was a patient with Gaudi Tofi in the toe, so it was just basically an office visit for this patient. No follow-up for this unless it becomes a problem. Next, so with my new medical record here, I have these 10-minute appointments I'm starting to use. So this is a 10-minute slot. I'm putting in matrix follow-ups in there. Next patient was a 56-year-old that had pes planus that got orthotics. Next was a 44-year-old that had some good results with Lamisil, so we did the Lamisil booster for them. Next patient was an 86-year-old female. She had a bunion, so we gave her she's an older female, so a bunion spacer, and she had one thick toenail, so we talked to her about nail fungus, no follow-up. Next was a 50-year-old, this female. This patient had right plantar fasciitis. They got the plantar the Pelto Special. So if you don't know, my staff know the Pelto Special is the basically the morning stretch, foam rolling, and then the night splint. And she also has some left forefoot pain with recommended shoe changes. She'll be back in about 3 weeks for a possible ultrasound and then going into shockwave if the pain's not better. Next would be a 67-year-old female. They got x-rays, kind of bilateral foot arthritis, and she was here actually for a follow-up of an ingrown. So she was here for an ingrown. Could have been a very kind of low-value visit, but I always ask patients, do you have any other things? And she had, I have this foot pain. I said, let's get x-rays. And then we looked at that, showed the arthritis, and we talked about like orthotics for that or cortisone injections for her. I've been having a lot of patients coming in, and I think it's because I have a new staff, but they're coming to me and they say, oh, the patient doesn't want x-rays, or the patient maybe doesn't want the post-op kit. I think a lot of times it's how staff explain it to the patient, so then I have to sit down and do kind of role playing with the staff and kind of explain how to explain it the proper way. The problem with not getting x-rays before they see me is that it just delays things. It's not so much that I don't mind. I'll usually explain it to them and they'll get the x-rays. But in these cases, just the delay of time of going from one room to the other. I tend to, as much as possible, stay in the same room I'm at until I get everything completed. I try not to go out and in. The only reason I would go out and in is if I'm doing like a numbing up a toe, and then I'll go do another room and then come back. But I try to stay in the room as much as possible. Next patient is a 77-year-old. He had a follow-up of Lamisil booster. He's doing well, and he had an ingrown toenail that I took care of. So a lot of these patients, I think this day was the day that I was recording a lot of videos. What I've been trying to do lately is, so there's this idea of like in sawmills, they take sawdust, and I've talked about this before. You take sawdust and you make it into plywood. And so what is the sawdust we have? Well, it's all these patient interactions. So can I take these patient interactions and make videos out of them? The rationale for that is then the best producing videos, then you can make those into ads, right? So the best producing videos that have the most views, most interest, then you can add a little call to action at the end of it for your ad. So that's kind of why I'm making more videos recently. I'm using something called SubMagic. It automatically adds subtitles. So what I do is I just take my phone and I upload it directly into that, and then a virtual assistant takes those and puts those on my YouTube. So that's kind of how it works. And then based on the best ones, then we can turn those into ads. I'm not to the ads portion yet, so I'm in the first video portion. So I'm still figuring out the ads portion, just so you guys know. Okay, next was a left plantar fasciitis. Did an ultrasound. And this patient had quite a bit of thickness, and this patient is going on vacation, so I did a cortisone injection. A lot of patients, if they're going on vacations or trips, I'll do I do a cortisone. This she would have benefited better from shockwave, and she may do that in the future. Next was a patient that had somehow gotten into my schedule, but she had nail care, but she also had like a right second toe, kind of an ulcer. I think that's why she came in. She should be coming in like every 3 months, but she wasn't, so she got on my other days. Next was a patient that was a 76-year-old that had a pain to the navicular tuberosity and posterior tibial tendonitis. I did an x-ray, I did an ultrasound. They're going to do the normal things, kind of the resting, anti-inflammatories, icing. They did not want the cam boot to rest it, just wasn't comfortable. They're going to be back in 3 weeks, and if not better, then I'll most likely recommend shockwave for that. Next was number 2 out of 6 for shockwave for plantar fasciitis. Next was number 5 out of 6 for posterior tibial tendonitis for shockwave. Next was a 54-year-old that had left first met cuneiform joint pain, and I did orthotics for this patient to help stabilize the joint. Next patient was a nail sample follow-up, and they got the fungal kit. Next patient was a 63-year-old that had an ingrown lateral side. They also had right Achilles pain. So this was an interesting one. This is a 63-year-old guy. He very successful in life. Went to see another orthopedist in a group in our hospital here. I was talking to my buddy. Like, he is single-handedly the best referral source for us to our office, is this orthopedist, because just some types of the treatments that he does kind of jumps into surgery for like everyone with Achilles tendonitis, or he's shaving down the back of the bone and reattaching it and just having difficult results with that. And so a lot of people come over for a second opinion. So for him, he had this like ingrown toenail with some swelling. It wasn't infected, and he was like, "Is there anything you can do about this?" I said, "Sure." And I said, "The reason you have this is because the callus in the nail edge." And I know you guys all know this, but I take it out, and then when I pull out the callus, I actually show him, because the ingrown toenail didn't look bad, but it was because it was built up all like callus in there. So I showed him that, and that he's like, "Wow, that's cool." And then the other side, he had insertional Achilles tendonitis. And I did an x-ray, and I said, "Hey, what we have to do here is the shockwave." And so he did shockwave. Now, this guy is very successful. He has multiple businesses, and he travels a lot. So he's like, "I got to be traveling." I said, "Okay, well, some patients, they do shockwave every week. That's like 6 weeks. But if you want to, like what the research says, is every 72 hours we can do this." So this was, I think, a Tuesday. So he's going to come in on a Friday afternoon. So he's going to come 3 days later. Every 3 days he's going to come in till he gets his 6 sessions done, so he can kind of jumpstart that. So that was like my MVP patient of the day, that second opinion. Next was a patient. This is kind of an interesting one. He's a 62-year-old male. He was lifting a really heavy cabinet, and he whacked his 5th toe and dislocated. And the thing is, like, kind of brawny, swelling, kind of dislocated laterally. I couldn't relocate it with my hand, and I wasn't sure if I would just leave it, because it didn't look all that bad when I saw him. On the x-ray, it looks a little bit off kilter, but if it calms down, he might not have to do anything. If it doesn't, then we're going to have to pin it in place, because I think he kind of ripped some of the soft tissue that was holding everything in place. So next patient was a 51-year-old. This was Swift number 5, and I set up number 6 and 7. So this guy has had warts for years and years and years. I record the number of Swifts just like I do shockwave, so I know what actual number I'm at. So he is more than normal, but I scheduled those for him. Next was a 24-year-old girl. She's a little girl that is in PT school, and I treated her mom. She sent her daughter. She has bilateral bunions, but at this young age, she has like a hypermobile kind of first ray and the bunion that she's going to need a lapidus. So I referred her to one of my colleagues here that's going to do that for her in the future. And then next was a 37-year-old female for a lamisil booster. And then finally there was a patient that was a 42-year-old that's been kind of dealing with some plantar fasciitis, had done shockwave in the past, was concerned about some tarsal tunnel. And I think this end of the day, I think I was hungry and I just wanted to get out of there. And I think I was going to have her get a second opinion with one of my buddies to see kind of if there was anything else going on that I was missing. So that's what I did. But as I was thinking back about this, I think really the reason I was like hungry and tired, I don't know if that happens to you at the end of the day, and I just didn't have as much patience as I probably should. And then finally there was a rusty nail, a little girl, 18-year-old, that stepped in a rusty nail at a bonfire. She had already been prophylaxed for tetanus. She was placed on an antibiotic. And this one I'm just doing a tight call on her, like calling her, making sure she's okay, because she was having some guarding. And so I was just really concerned about a deeper infection that might not have gotten better. And I told her if it does get worse, she's have to go to the ED. Okay? So anyway, hope you guys found this beneficial. If you don't know, there's a website called Podiatry Practice Mastery. On there, I have this $1 million practice blueprint that you may be interested if you haven't downloaded. I think it would be open up some insights to how kind of our practice, what worked for us to get to the $1 million mark for the providers. Okay, thanks.